everyone, this is Kitty. Kitty has called the ambulance today because she has a sore arm. She fell over and she's got a broken arm. Not a broken arm, just a sore arm. Haven't you, Kitty?
Yeah.
Okay. All right. So I'm going to do a paediatric assessment on Kitty. I have my Oski sitting beside me, which I would highly recommend that you do. So I consider that my scene is safe. I do have a safe scene, although don't walk out there with taking the handrail off the balcony. I'd give an ethane report if appropriate, but I don't need to give an ethane report for this. This is not a life-threatening injury. I'd utilise standard precautions. If Kitty was coughing or spitting or anything like that, I'd have a set of gloves on. If there was any blood, if I was doing anything to cause any blood, I'd have a set of gloves on. But that's not happening either. So Kitty, I'll explain what's going to go on. I'm going to assess you to make sure that you're okay and see what I can do for you to make you feel better. Is that okay with you?
Yep.
Ask and gain consent. I'd also ask her parents and gain consent from her parents as well, and that's me. Okay, assessing responsiveness. So AV, PLU. So I can tell Kitty's alert because she's standing up and she's already responded to me. There are no obvious life threats. I can tell by the great big smile on her face. Smile to the camera. There, no obvious life threats. I have 360 access to the patient. She's standing up. I can get all around her. And I need to introduce myself. Hi, I'm Tony. I'll be your paramedic today. What's your name?
Kitty.
Oh, lovely. And hi, Mum and Dad. Okay, so I'm going to use the PAD assessment first to assess Kitty. Looking at her appearance first, she looks, she's standing up and she's happy. I'm going to do this with it, and I do my PAD assessment without touching her. Her work of breathing is fine. I'm looking around in her neck. She's not using any extra muscles. There's no tracheal tug, and her circulation, she's well perfused. So PAD assessment is through, no issues. So I don't need to do a further rapid assessment. I can go through and do a complete nose to toes. Her airway. I know her airway's open because you said hello to me, didn't you?
Yeah.
Yeah, so her airway's open and clear. She's not coughing, standing up and she's smiling. Breathing. So I'll assess her breathing. Closer. And I'll also take in 4 places just to make sure initially that she's breathing okay, which she is. And I'm just going to listen to her rate and her depth. And she's breathing wonderfully well. Good job. High five. Okay, circulation, I'm going to feel for her pulse. And she has a pulse here, and it's a lovely pulse, nice and strong. So I'm assessing her pulse for rate, rhythm and quality. Also assessing for skin colour. She's got a beautiful colour skin. She's not pale, and in her peripheries she's not cyanosed, pinching her fingers, and she has a good capillary refill. She's not blue around the lips. So yes, she's quite well perfused. Disability. We've already worked out that Kitty's alert. Now Kitty, do you know what date it is today?
Thursday.
What month are we in?
May.
What year is it?
2019.
It is 2019. Well done. What is your address? Here, yeah.
12 Heron Place.
12 Heron Place. Absolutely. So I'm pretty happy to say that Kitty is a GCS at 15 after answering all those stuff. I'm not going to expose Kitty. Do you have any pain anywhere at all, Kitty?
No.
Okay, just the sore arm which isn't sore anymore.
No.
Oh, that's wonderful, isn't it? So based on all the assessments I've done in my CUPS procedure, I can say that Kitty is well and truly a stable patient. I'll then go and do some vital signs. I would again auscultate her chest and her back, listening for her lungs. I'd take a blood pressure if I had a blood pressure cuff. I'd take a pulse over a minute. I'd listen to a respiration, take a respiration over a minute. Saturation monitor. Take a blood sugar if I thought it was relevant. Kitty, do you have diabetes?
No.
No? Okay, so I probably don't even worry about that because you're GCS 15. I take a temperature. I probably wouldn't even need to take an ECG, but if I wanted to, I could take an ECG as well. So there you go. I'll then go through and look at the signs and symptoms. So Kitty, you hurt your arm, did you?
Yeah.
And it's better now, is it?
Yes.
Okay, so it's not really causing you any grief anymore?
No.
Okay, so my signs and symptoms are fine. Are you allergic to anything, Kitty?
Yes.
What are you allergic to?
Caterpillars?
Really? Or did you just make that up?
No.
Okay. Okay, we won't give you any caterpillars today. Okay, do you take any medications? You don't take any medicines, do you? No.
No.
Okay. Big girl voice? No? Okay. Did you have breakfast this morning?
Yes.
What did you have?
Wheat Bix with sugar.
Wheat Bix with sugar. Was there more sugar than Wheat Bix? Probably. Okay. What time was that?
Around 8.
Yeah, 7.
Yeah.
You get up at 7, don't you?
Yeah.
Okay. And what happened to cause you to have a sore arm?
Fell over?
You fell over?
Yeah.
Good job. Okay. All right. So, that there is the paediatric assessment. Thumbs up. Thanks, Billy, for recording.
You're welcome.
Right, Tony.